Welcome to this educational presentation on endoscopic microdiscectomy for the treatment of herniated lumbar discs and spinal stenosis. Dr. Marion McMillan and the staff of Foothills Regional Pain Center will discuss this innovative, minimally invasive outpatient treatment options for patients with herniated lumbar discs and spinal stenosis who desire to avoid open spinal surgery. Actual Foothills patients will describe their experiences and treatment results with the procedure. Located in beautiful upstate South Carolina, the Upstate Pain Management and Surgery Center in Seneca is the operational hub of the Foothills Regional Pain Center practice. It is here, in this state-of-the-art surgical facility, that endoscopic microdiscectomy and other surgical procedures are performed.
Upstate Pain Management and Surgery Center is our base, and it is the only Medicare-licensed ambulatory surgery center in South Carolina fully dedicated to advanced pain management care. Our facility is one of two facilities in the southeastern United States and perhaps a handful nationwide where these procedures are done and offered exclusively to patients. We have a national reputation. Our staff members are consultants with major spine care organizations. I myself am on the teaching faculty of a major manufacturer of endoscopic spinal equipment, as we seek to educate not only patients but the professional community with regard to this new and exciting capability.
We do have some patients that will say, I've looked at this on the internet, I've really researched it, but I'm still not sure about this new procedure. I will call the patient, and they are so glad that somebody calls them and talks directly to them in a timely manner. And if they tell me certain symptoms, I can tell them if we probably will be able to help them. Usually they've had chronic pain for many, many years, and they've been turned down by doctors, say we can't do it, or they say we have to open you up and put in plates and screws and rods, and the people are afraid of that now.
Patients frequently have questions about the nature of high-tech procedures such as endoscopy, and they want to get a visual image of what the procedure actually involves and why we think it's so much better than existing surgery. So we prepared an animation which is an artist's conception of how the endoscope is placed in the patient all the way through removing fragments of disc to give the observer a better mental picture of what's actually being done and why we think it's so much better than existing open surgery. The animation shows a side view of a herniated disc pressing a nerve in the spinal cord. First, a needle is placed into the side of the patient, which will allow us to locate the instrumentation in the proper location. Next, a dilating tube is placed over the needle to gently spread tissues rather than cutting them. After the dilating tube goes in place, a working tube or a working cannula, which will receive the endoscope, is placed over the dilator. The next step is to place the endoscope within the working tube to position it precisely in front of the herniated disc so that it can be removed endoscopically. Once the endoscope is placed within the spine, special instruments are used to remove the herniated disc under direct vision, thus relieving compression on sensitive nerve endings. The process frequently occurs in stages, followed by clear visualization of removal of the herniated disc. Next, the defect left by the herniated disc is carefully sealed with a surgical instrument to prevent future episodes of herniation, followed by placement of a laser probe to shrink and tighten the damaged disc to further decrease the likelihood of future herniation. The entire process usually is completed within 1 to 2 hours. Many times, symptoms that would seem to suggest more serious ailments turn out to be more simple ailments which the pain management practitioner can handle without any kind of surgery. Sometimes an injection, sometimes physical therapy, sometimes medications will suffice to eliminate the patient's symptoms without surgery. But for those patients for whom conservative therapy fails, once the diagnosis is clear, if a patient winds up having herniated disc, painful disc, spinal stenosis, now we're no longer forced to commit those patients to open surgery, but we can treat them with outpatient endoscopic, laser-assisted, and other minimally invasive treatment methods that have only become available in the last 5 to 10 years.
What I'd like to see is more family physicians offer this option up, because most of them are very close to the traditional way of doing things. And it has to be something that you need to research, you need to look into it. But once you make those decisions and you discuss it and you think long and hard about what's right for you and how fast do you want to get better and how do you want to live your life, I think it's an option that you really should consider. It really can help many people. I know it helped me. And when I see other people who are suffering like I was, it's the first thing that I tell them. It's like, it's something you need to investigate. It's something you need to explore, because it really can make a huge difference. I came in, I was awake during the entire procedure, which is a little different, but my incision is teeny. I mean, you can barely see it. And the procedure, you know, it's always uncomfortable just to have somebody working on you, but it was probably easier than when you go to the dentist and have a filling in your tooth. And I literally had the procedure. I stayed in the recovery area for about 30 minutes, drank some juice, and walked out with my husband. I went home and slept for a while because they do give you sedatives to keep you relaxed. But I woke up that evening, I sat down and had dinner with my kids, and I was functioning pretty much normally.
Traditionally, the management of herniated disc and spinal stenosis has involved open surgery, open surgical management. As technology has progressed, as patient awareness has spread, and modern approaches are being used, now patients truly have an alternative for managing these very common, very serious, very devastating conditions, such that for 90% of patients with herniated discs and spinal stenosis, open surgery is no longer required. Endoscopic microdiscectomy represents the fulfillment of 30 years of clinical research and development in spinal medicine to deliver the promise of truly minimally invasive surgery and make that a reality. It's a wonderful opportunity.
I went to several chiropractors, physical therapists. I'm a regular doctor. After pain shots, pain pills, finally the physical therapist told me there was nothing that they could do. She referred me back to my doctor, and at that time he told me that surgery was the only thing that could be. Luckily I saw an ad on TV for pain management. I contacted Dr. McMillan. He set up an appointment with me, and first thing he told me after a short visit that he could help me. Once he said that, I felt better, and a little over a year ago he done the surgery. I've done fine since then. Matter of fact, I came down here on a Friday afternoon with a cane. I left here 2.5 hours later without a cane. And 2 weeks later, I was back to work.
We feel that we all have a God-given purpose in life, and we try to connect patients with their emotional needs, the emotional impact of disability, the emotional impact of chronic pain, desperation, hopelessness, and try to be a beacon of hope in a patient's life to let them know that sometimes the darkest hour is just before the dawn. We believe that patients are more important than dollars, and that our primary mission in life is to glorify the name of the one that sent us. We feel very strongly about that.
We feel like that faith and medicine go together with our patients, and we feel like this is a vital part of our purpose here at our surgery center.
On my first visit here, he told me that he could help me, and I had a sciatic nerve, and my pain would go all the way down my leg sometimes, and it was excruciating. After the procedure, I walked out of here. I had immediate results, and I can't remember any downtime at all.
It was probably the easiest thing I've had to do, and I was going through such a horrible time with the pain and everything. It really made a difference, and at the end of the day, the best thing about it was that my family got me back because I wasn't in pain anymore, and I could play with my kids again. So it was a huge moment. So I definitely think if it's something that you're having these issues, you're having that chronic back pain, and you're having to rely on pain medication, and you can't function the way you want to function, it's definitely something to explore.
We hope you have found the preceding educational presentation helpful and informative. For further information concerning endoscopic microdiscectomy, as well as additional minimally invasive treatment options for spinal pain problems, please contact Foothills Regional Pain Center at the above address. Operators are standing by.